So, in this joint, look at what we have. 1, 2, 3 joints that they consider being present. Humero-ulnar. The area existing between the humerus, the ulna, humeroradial, humerus radius, the proximal radio-ulnar, what we find between the radius and the ulna at the point of the joint. So 1, 2, 3 is what they consider to be present in this area. Like I mentioned, the shape of the trochlea, we're going to be limiting movement. We're allowing movement in one plane. All right? Now, that idea of a hyperextension, okay, that means we would take that joint past the point that would be considered the stopping. So that's not a whole lot of fun if you've ever done that to a joint. Got some ligaments that are pretty cool existing in this area. Also some bursa. Because anytime that we're going to have muscle and ligaments passing over bone, we definitely want some bursa to be present. My next joint down, hip joint. Know anybody that maybe's had hip replacements or anything like that? Yeah, know several people. Cool thing about it, they've come a long way with the hip replacements. All right. It is a ball and socket. We have in this area the acetabulum. All right. That has its ring of fibrocartilage. So if we're looking at this like impression that the ball and socket fits into, which is not really, showing us. But if we look at the depression that the ball, the head of the femur is fitting into this depression on the hip, this is the area that's going to be that acetabulum. And it's going to have this ring of fibrocartilage in it, making it, of course, have this compression that's present. Nice cartilage to have, okay? Problem is, we do abuse it and so forth, so it'll wear down. But something else, we've got a ligament that's present. And that's going to be a pretty cool ligament. This transverse acetabular ligament. And I think I got a picture of it. Yes. So hold on to that thought. Okay? Now, it's more stable in the hip area than it is in the shoulder, but it's bearing the entire weight. Okay? We've got all this weight of the upper body that these hips are having to bear. Okay? Therefore, less mobile. Even though we're saying ball and socket, the ranges of motion are not as great in the hip as they are in the shoulder. There's going to be a definite difference. Once again, we get flexion, extension, add, rotate, circumduction that's present. We have a very strong joint capsule. They're trying to represent being present. We've got ligaments, including something called the iliofemoral ligament. And those ligaments help us bear the weight of standing. Like I said, evolutionarily, we are not supposed to be upright, okay? But because of the arches of our feet, the hip has stabilized so that we are bipedal upright, which is kind of cool. There is a ligament at the head of the femur that you'll see, and usually when you look at the bones, all right, they kind of show this huge deep pit right here on the head of the femur, okay? And that's going to be what we call the round ligament. And most of the time, it's going to have with it a nutrient artery. So we're going to find the access to blood supply for this joint. Now, this particular joint, based on the structure that's present, it allows, because of the way that we've got these ligaments and everything that are present, it allows for them to basically shift so that when we go from sitting to standing and they shift into the standing mode, in the standing mode, they actually tighten and pull the head of the femur tighter into the hip so that you can allow for the weight of standing. So their structure is pretty cool in this particular joint. Basically, they'll shift like this way when you sit down, and then when you stand, they'll come back and pull the bone up into the hip, up into the acetabulum, so that you have that ability to stand upright. Now, that area around this huge depression, okay, that's where you're going to find that ring of fibrocartilage. Now, this is that ligament at the head of the femur that goes right into the head and continues down. And that's going to usually have the nutrient artery with it, because that's where we're going to see that we've got a very good blood supply to this bone. Huge blood supply that runs into the femur, because the femur is the largest bone in the body, and it's going to be a major area, especially in children, not so much us as adults, okay, but in children, an area for blood cell production. So therefore having the structure that it does. So, ball and socket coming into this area. On the femur, I think I have you guys studying some of these special terms associated with the femur, okay? Like our greater trochanter, lesser trochanter, okay? I think I've got you guys studying some of that. These are the ligaments that exist. It is going to be a more stabilized joint of the body, however, still prone to damage, okay? We can have everyday damage done to it also. We can have everyday damage of where we're just not, our regular walking, jogging. Any joggers in the class? Worst thing you can do to a body. Jogging affects all of it. It affects the feet, it affects the ankles, it affects the knees, it affects the hip, it affects the back, which will travel upward. Yeah, think about it. That's why you don't see me running. Okay? You're only going to see me running, like I said, if you see me running, you need to run with me, okay? Because there's something on the way. Now, the knee joint, I've mentioned several times, okay? Mainly because it is going to be one of the most damaged joints that we have in the body. In the knee joint, let's take a peek at it. Y'all gonna have to share. No, I'll take the one that's broken. The knee. Just take a peek at it. Look at it from posterior, look at it anterior, look at it lateral. Open it. Check it out.
Ours doesn't do that. I was about to say,
Oh, this one's broken.
yeah.
Yeah, I took the broken one. Sounds like one of those things you put on your desk and you know, get the things to moving. Some, whatever they are. Well, you know how like it's like these little things you set on your desk and you start one end and it clacks and clacks, clacks.
Yeah, isn't that called, like,
I don't know. Now, the structure, condyloid, gives us a little bit of rotation. Trust me, I don't want a lot in that area. Definitely our flexion and extension. All right. This is a good representation of this patellar tendon, okay, that's running from femur to tibia, okay, showing us good representation, lateral ligaments that are present. These are the ligaments that are existing between the bones, like the ACL. ACL would be the one that's most anterior, okay, the one that gets torn a lot. Okay, this one is the posterior. They create this X shape in the knee, giving stability between these two bones. We've got our lovely menisci. All right. Oh man, nice, wonderful, perfect. Till you tear them.
question. What's meniscus and menisci? What's the...
Menisci means more than one.
Oh.
So this would be like meniscus, but we've got menisci because there's two.
I got you.
Yeah. And looking at its structure, you would think, well, okay, well, if I tear something in here, it's not going to be too bad. No. The blue stuff that's existing on the ends, that's the articular cartilage. Remember how I said what you get is what you got? Okay? This is not anything that changes over time. As this bone grows throughout growth and development, nothing happens to that articular cartilage. All right? So we're ending up with a structure that's going to have some issues to it. Now, if we take a peek at this meniscus, thank you, and it tears. Now let's think about it for a second. Cartilage, no blood supply. The nerves are out here in the capsule of the knee. How is it that I know I even did anything to the menisci in the knee? Hooks into that articular cartilage. And then the pain hits. And depending on the tear. Now, what does that mean it's doing to the articular cartilage? Because usually it's like a little flap that you tear up. Okay? What is it doing to that articular cartilage? It's poking into it, it's irritating it, and it's destroying it, creating a hole. And that's the cartilage you don't want to lose, because this articular cartilage helps to keep those bones, even though we've got this huge meniscus, okay, helps to keep those bones from becoming bone on bone.